Do you have shoulder pain or have you been told that you need shoulder surgery, like a rotator cuff repair? My name's Dr. Don Buford, and I wanted to share this brief patient testimonial with you to show you how we can use the latest evidence-based regenerative medicine techniques to often avoid doing shoulder surgery. These techniques are done in the office. They're done using your own blood or your own bone marrow. And using these techniques, we can get results like we can illustrate in this patient testimonial. Give us a shout. Reach us through our website at texasorthobiologics.com. Call us at 877-777-8883. You should put us on your list because we're America's #1 rated orthopedic surgery and regenerative medicine clinic, and we probably have a solution that'll work for you. So listen as this former D1 college athlete explains to us how she's doing 2 months after a platelet-rich plasma injection for a high-grade partial thickness rotator cuff tear. She had seen another surgeon, had actually been scheduled for surgery, and found us online and decided to see if we had any potential non-surgical options for her. Okay, Dr. Buford here with one of my favorite patients, and she is in for a 2-month follow-up. I'm going to just describe what she had, and then we'll hear in her own words how she's doing. What she had was a long history of symptoms and pain and dysfunction from a chronic high-grade partial tear in her right rotator cuff. You're right-handed, right? Correct. Yeah, and she has a history of being an athlete, played basketball at the University of North Texas, so she's very tuned into her body and how her shoulder works. She did not want to have rotator cuff surgery, so she found us searching for alternatives. And so what we did for her was an injection in 3 different places into the shoulder joint, the glenohumeral joint, into about an 80% tear in her supraspinatus tendon, which is part of the rotator cuff, and then above the rotator cuff in a part of the shoulder called the subacromial bursa. And so we're 2 months out from that. And so now I'm going to turn it over to you. Tell me how things have been going. Things have actually been going great. As I explained to Dr. Buford, I had this ongoing pain here uh, for years. Within 2 weeks of the injection, the pain was totally gone. And I have been able to do more, increasing my exercise, my strength training. And now I'm back today for a follow-up. Great. And let's see your motion today. If you raise straight to the front. So your motion is all the way back. All the way back. Show me that little trick you were showing me earlier where you do the internal external rotation. And this is something that was extremely painful for me to do prior. I could barely hold my arm up in this position, not even mentioning trying to, turn it down and up again. This was non-existent. So now, no problem, nothing.